Yeah, Dr. Deepti.
Hello everyone. So welcome to this communication IC. Thank you Krishna Prasad sir for including me. With HMR sir, I would like to tell one small event he told me about. Just told us about the drops being put in somebody else's eyes. I think I am a pediatric ophthalmologist and I prescribe atropine normally for checking the refractive accomodativities. And it so happened that the very next day I received the call from the dad. मैडम मेरे आंख में लाल था मैंने डाला पूरा धुंधला है आई सेड अभी और 14 दिन धुंधला रहेगा इट इज सो दैट डे आई एक्चुअली रियलाइज्ड फ्रॉम देन आई नॉट जस्ट एक्सप्लेन ट्वाइस ए डे फॉर 3 days आई टेल घर में किसी और को आंख लाल है तो इसको मत डालिए ये सिर्फ टेढ़े आंख का टेस्टिंग के लिए है टेस्ट होते से ही फेंक दीजिए सो आई थिंक दिस स्मॉल थिंग्स really matter and which we pick up during our own practice. So with this now I see a communication pearl for young ophthalmologists, very few young ophthalmologists PGs over here. So this is something which is totally video based. So this is a scenario one.
बस हुआ पीछे जाइए आप बाहर बैठिए सर एक बार देख लेते हैं हाँ 10 मिनट बाहर बैठिए उसके बाद सर देखते हैं.
So what was lacking here? The patient was trying to tell her complaints and the postgraduate bar fellow wanted to just finish her work. So there was nothing called listening. She was just hearing. Listening is a art, hearing is just a physical thing. So it is considered that when you open any communication presentations in the YouTube or in SlideShare, it is told that listening is the most difficult skill to acquire. It requires lot of practice. Keep your minds open as you listen. There are many times when the kids enter my OPD, I see their eyes yellowish. I know it is a case of VKC. I know it is an allergic conjunctivitis, but then there could be a hidden post long term usage of steroids. There could be a hidden glaucoma over there. There could be a hidden astigmatism over there. So we need to listen what other complaints have the patient come to us despite the clinical signs being very evident. And if we are really if we have had a real tired day and we are really tired to talk to them at the max, I think we can respond by a simple nod and okay, or just maintaining an eye contact with the patients or the parents in the room actually makes them happy that she is looking to us. Back of the brain kuch bhi chale unko pata nahi chalta hai. Keep listening to them. I think that makes half of the diagnosis, I mean half of their treatment done. They go back very happily. So now this is the second scene. From the OPD, I go to the OT.
थोड़ा वॉल्यूम बढ़ा ना.
बोला था ना तुझे छोटा एक्सेस नहीं करने को हो गया ना अभी कॉम्प्लिकेशन अभी क्या करेंगे रुक मैं वॉशरूम के आती हूँ फिर देखते हैं ओके.
Now imagine the patient situation. She told, "Are yaar shit." So he knows his condition is yes. I think so. That word explains it. And she said, "Drop ho gaya." So the patient again knows there is something which is dropped now. And the third thing, the one who was supposed to assist her, बोला था ना छोटा एक्सिस नहीं करने का. So she said the mistake is the doctor's. So the patient, whenever one sense organ is not working, the other sense organ becomes very very active. So it's just that the eyes have been closed by the drape, but the ears are super active of the patient. So every small thing whatever we utter in the OT actually carries a lot of impression. The patients carry it back. So many times they come and ask us like, madam आप लोग ये बोल रहे थे इसका क्या मतलब है आप लोग वो. So when we're seeing the post-op we realize they have heard everything whatever we have discussed in the OT. So try keeping the operation theaters as formal as possible when you start doing the same, and unnecessary talks, unnecessary words have to be avoided as much as possible in the operation theater, be it your consultants who are operating or you yourself who are operating. Take care of this one aspect. The next would be my next scene. I again shift back to OPD.
डॉक्टर एक्चुअली क्या हुआ 3 दिन पहले मेरा ऑपरेशन हुआ अच्छा दिख रहा था
मतलब वही क्या सेप्टिक
हाँ हाँ वही वही जो हर बॉडी में हर जगह होता है इन्फेक्शन, वही आपको आंख को भी हो गया
क्या
है।
करना है डॉक्टर?
अभी
मुझे
क्या
लग
कर
रहा है
सकते हैं, इन्फेक्शन तो हो गया। अरे वो बाद में सोचेंगे, अभी रुको, डॉक्टर आके देखेंगे आपको, इधर ही बैठ।
So, in the era of litigation, when every single word what we utter can be taken against us, just telling the patient bluntly, without any emotions, without any empathy, that the patient has got an infection, नजर नहीं आएगा, जो हर जगह जो infection होता है वो तुम्हारा आंख में भी हो गया है. So for us, yes, it may be a simple task, it may be an endophthalmitis. We know we have our own retina setup, we know that things can be cleared, yet still for the patient, for the patient's attenders, that is a major thing. They have paid for the cataract lens, they are expecting something wonderful out of the hospital. So every word what we say in front of them actually can backfire. So these are the multiple articles which say that patients, moment we say there is a loss of vision or there is an infection, such things can happen, the media can take place. So what differently could this thing have been done is,
डॉक्टर मुझे एक्चुअली मुझे 3 दिन पहले ऑपरेशन हुआ था डॉक्टर, इस आँख का तब अच्छा दिख रहा था, सब कुछ दिख रहा था. अभी एक दिन से कुछ भी नहीं दिख रहा है डॉक्टर, मुझे बहुत दर्द हो रहा है.
टेंशन मत लीजिए, एक मिनट यहाँ पे रखिए, इधर रखिए। डरने की कोई बात नहीं है, आप करेक्ट टाइम पे आए हैं, थोड़ा सा रिएक्शन हुआ है बस, करेक्ट टाइम पे आए हैं, टेंशन दर्द कम हो जाएगा, अभी ट्रीटमेंट देंगे, अभी बैठिए, अभी सीनियर डॉक्टर आके आपको देखेंगे, टेंशन मत लीजिए। पानी चाहिए आपको? हाँ, कुछ कुछ प्रॉब्लम नहीं।
okay, so that small act of pani chahiye aapko and making the patient comfortable is what matters in our OPD. So I think what ma'am stressed over here, Kirti ma'am, empathy, just put yourself in the shoe of the patient. Tomorrow I may undergo a cataract surgery, tomorrow I may develop an infection. So that is the thing, my own parents can do the same and that can happen to them. So putting ourselves in their shoes actually makes us feel a bit empathetic. So rather than being blunt to the patient, rather than using the words like infection, a small shift in the word like reaction maybe can put you in a safer aspects as an younger ophthalmologist, as a young ophthalmologist. As such, the young ophthalmologist, we don't look really old and people really think that we are in the hands of a young ophthalmologist. This is really, I think I have faced it for the past 10 years. Even now people ask me, आपके बच्चे हैं, आप हमारे बच्चे को देखोगे ना अच्छे से. आई हैव पुट ए फैमिली पिक इन माय ओपीडी कि मेरे शादी हो गया है, मेरा 2 बच्चे हैं, मैं बच्चों को संभालना जानती हूँ. So I think these are few things which patients really, the age, the baldness, my fellow who was bald used to receive more patients than me because people used to think he is older. So young people, every step what you take actually, okay HMR sir, I didn't mean that. So
No, not that.
okay, this is
photo, not that
the
photo.
time constraint.
Instagram, please. Not that. Please crop me if you're putting that photo and edit something, do something, put some beauty face, do something.
Look at his
Okay,
face.
I'll get back to you in some time and I'll send you one more photo which you can put. चश्मा निकाल ली? क्या हुआ?
आंखों से पानी जा रहा है डॉक्टर को।
इधर आना एक बार. ये सब कब से हो रहा है?
10 दिन हो गए डॉक्टर।
हाँ हाँ ठीक है ठीक है. कुछ दवाइयाँ ले रहे हैं क्या?
नहीं कुछ नहीं डॉक्टर।
Hello? Yeah, I've sent the photo which you should upload. Please upload that photo, not this one, and tag me also. And do some nice editing work, please. एक मिनट, I'll get back to you. कब से इशू सब शुरू हुआ बोल रहे हैं आप?
10 दिन हो गए डॉक्टर।
हाँ ठीक है. एक बार इधर आ जाओ.
So she forgot in the middle of her phone calls that she had already evaluated him.
हाँ ठीक है. हेलो. हाँ how many likes did we get finally? हाँ ये prescription उधर लेके जाइए, वो explain करेंगे, ठीक है? हाँ how many likes? We got some comments also. That's fun.
So this is known as distracted doctoring. Yes, every one of us have our own mobiles. We have our own Facebook accounts. We have our own Instagram accounts. The number of likes really matter. Even to me, the number of likes matter. And there may be sometimes some emergency thing happening at home for which you need to keep in touch on WhatsApp or whatever mode of communication. But make sure that you take a break. I actually have a protocol in my OPD. After 2 hours, I take a break of 10 minutes. I have something, a biscuit or a water, and at that time I check all the messages. I reply, just give me 2 more minutes time. Anyway, one speaker is not there, so I make sure that I see that those time I check all those things, but it is 100% mandatory that we don't check our mobile in front of the patients. Never use medical apps in front of your patient. So patients are seeing, ऐसे देखते रहते वो हम क्या कर रहे हैं. So never use, so they know we don't know the diagnosis. Many a times there are so many new things which we have to search on the internet. Do everything after putting at least a Ziploc drop, make the patient sit outside, then you can check everything, call him back inside and do the treatment, but patient के सामने mobile नहीं खोलना. So this is something which is, this is my last video, I think, which emphasizes on the empathy. आइए बैठिए, क्या प्रॉब्लम है?
मैडम बच्चा देखता ही नहीं है, मुझे पहचानता नहीं है, इतना टाइम हुआ, किसी को उसको बुलाते हैं तो भी देखता नहीं है.
नॉर्मल डिलीवरी हुआ था बच्चे का?
डिलीवरी नॉर्मल हुआ था मैडम, लेकिन रोया नहीं था बच्चा डिलीवरी के बाद.
फिट्स आया था?
फिर से 1-2 बार आया था, डॉक्टर को दिखाए थे हम, उन्होंने दवाई वगैरह चालू किया है, अभी तो ठीक है बच्चा.
तो बच्चा रोया नहीं, बच्चे को फिट्स आया था. अरे ऐसे में ये ब्रेन पूरा डैमेज हो जाता है बच्चे का. ये आंख का प्रॉब्लम नहीं है मैडम, ये देख नहीं रहा है लेकिन फिर भी आंख में प्रॉब्लम नहीं, पूरा ब्रेन ही. बच्चे का गर्दन भी नहीं बैठा होगा अभी तक, तो ये चलेगा भी नहीं, बच्चा बैठेगा भी नहीं आगे. हमारा काम नहीं है ये. ब्रेन के डॉक्टर को दिखाइए, आंख बिल्कुल ठीक होगा बच्चे का. जाइए जाइए ब्रेन के डॉक्टर को दिखाइए, जाइए, हमारा कुछ काम नहीं है इसमें. So the last point which I would like to stress is be empathetic. There are so many children like that, there are so many parents like that. There may be an optic atrophy, there may be Leber's hereditary optic neuropathy, where you may know that nothing can be done maximum from our side to the patient, but maybe telling it the same way, in the gentle way, helping them in whatever small way that we can do, a low vision aid, maybe a vision stimulation exercises, putting them in touch with a corresponding neurologist, helping them in every single way is what we are made for. I think with those small words, the patients, it's not that patient may not be bringing much to you, but that patient will go and tell other patients about you, and that will bring more patients and more for us from the professional point of view also. So be empathetic. The special situation would be taken up by Madhav Ambekar sir. I wouldn't be stressing with it. So finally I would like to stray is, we practice what we learn. Good communication means half of the treatment done. So the rest of the treatment is just writing maybe loteprednol, fluoromethanol or whatever rest of the thing. But it's the communication which takes up 70 to 80% of our practice. So all the best to all the young ophthalmologists over here. With this IC, if you can take back even a few words, we would be really happy. Thank you.
Thank you, Dr. Deepti. That was a very illustrative ideas that the PGs should actually learn. So thank you very much. Now we have Dr. Madhav Ambekar, who will be breaking the bad news. The bad news is, Dr. Ambekar, you have only 10 minutes because Dr. Quresh is coming.
Okay, that's right.
And he is the showstopper.
Yeah.
So this is a very important topic, because that is where it differentiates a very good doctor from an average doctor. It's not about telling the good news. Anybody can break the good news. But how to break the bad news is something that really defines your character as a doctor. Dr. Madhav.